So this short video clip is to define biomechanics at a little bit deeper level and how we talk about it within the Biomechanics Education Academy. So as exercise professionals and personal trainers, Pilates instructors, yoga teachers, even sports therapists, we practice biomechanics to some degree. What I mean by that is, on a simple level, biomechanics is understanding and looking at the way people move. We class that as extrinsic biomechanics, and extrinsic biomechanics from that simple end can transition right up into a complex end where it's sort of forces, vectors, first, second, third class levers, video gait analysis and so on, some of which you may have experienced on a sports science degree. And it's the type of biomechanics that most people talk about or understand. It's the kind of biomechanics that when you're looking at your client squatting, for example, and maybe when they squat, just give you a little demo here, you might have seen as your client squats that their knees cave in, for example. Now, when you see this and look at their extrinsic biomechanics, which is kind of how they perform a movement, what we do is we verbally or visually coach them to keep the knees in line, understanding that better technique will reduce the risk of injury. Am I right? And then sometimes your coaching and your visual cues don't work. And that's certainly happened to me over the 20 odd years that I've been in the industry. And it baffled me because I thought, is that me? Am I doing something wrong? Chances are you're not doing anything wrong at all, and it's something else in relation to their biomechanics. So what we talk about and teach you how to assess and correct in the Biomechanics Education Academy is the intrinsic biomechanics. Now, how does that differ? Yeah. Well, the intrinsics is how you're stacked up on the inside. So your three subsystems, your skeleton, the muscles and the nerves, and the integrated system, and how that all impacts on the way you perform your squat or run or move. So what I mean by that is, let's say your client that you're asking to do that squat spends 8 hours at a desk, and their body has evolved to that position to some degree, so that they're getting used to or evolving into that kind of fixed 90 degree of hip. Yeah, they've got some adaptions intrinsically with those subsystems. So that when you're asking them to squat, they're not quite in the right position. And as they come down, the brain is sensing something's not right, and it's asking the knee to cave in, maybe to protect the back, because the pelvis is twisted, which is a common problem that we see. We consider then, actually, would making the knee stay in line be the best thing to do if that's what the body is trying to do deliberately to compensate for the fact you have something not in the right quite in the right position? It might not be. So if we can understand the intrinsics better, get them moving on the inside better, get them moving more freely around the hip, the spine, the joints, etc., and understand capacity and load when it comes to the three subsystems, correct that first with low-grade, I move freely type antispasms, nerve mobilizations, etc. Then when we ask them to squat, whatever is left is probably technique or proprioception or memory recall to what they should be doing. So if we can understand that difference, and that is really where the Biomechanics Education Academy can help you in your businesses improve the way your clients move, reduce their risk of injury, and optimize their performance levels. If you have any more questions around this, you can email me, Rachel@biomechanicseducation.com. Otherwise, stay tuned.